The first thing that we wanted to talk about was the isolation rooms and why people are in isolation rooms and what that means for staff. So the CDC has recommended that patients be in isolation rooms with negative airflow, primarily just to make sure that air is circulating frequently, and that helps protect staff and helps protect our other patients. This is not an airborne disease, so we don't need it for that like we would in a situation with tuberculosis. Where it can be aerosolized is in procedures such as nebulized treatments that respiratory therapy would do, or in intubations or using a BiPAP or CPAP. So because of that, medical staff is already working really closely with RT and infection prevention, and actually even IT, to create order sets that will minimize those procedures. We're going to minimize nebulizers, so the physicians are going to use the respiratory protocol, and then the respiratory therapist will come in and decide what can be done with an inhaler instead of a nebulizer, which doesn't aerosolize the virus. So we're putting that on our order sets. We are building order sets to help take care of our COVID patients so that we don't have to second think those in a crisis situation. And pharmacy is working on procuring that. So we're working as a team to make those times where the virus is aerosolized as minimal as possible. We're also just going to skip the whole using the BiPAP as a BiPAP and go straight to intubation if the patient's in respiratory distress.
SARS-CoV-2 spreads through droplet and contact transmission. What that means is that the PPE that we use to keep people safe is a face shield or goggles with a mask, gowns, and gloves. The hospital also has built-in engineered controls to keep people safe. So they've done some studies, and it is possible for this virus to be aerosolized or airborne. Whenever there's a procedure done that creates tiny droplets that are less than 5 microns in size, those can remain suspended in the air. So things like nebulizer treatments could create those droplets that would remain suspended. The studies that they've done are in a very controlled environment. So they aerosolize the virus in an airlock room, so there's no air movement, there's no ventilation at all in this airlock space. And then they measure to see how long do those particles remain suspended. And it is as long as 3 hours. However, the hospital, again, has those engineered controls. And so every room in the hospital has between 6 and 12 air exchanges per hour. So what that means is every 6 to 10 minutes, the entire volume of air in a patient room is exchanged. So the air that is in that space is drawn out and fresh air is pumped in. The hospital also has airborne isolation rooms. Those have a negative pressure. And what happens in those spaces is that there's a slight vacuum pulled on that room, and that just prevents anything that might be in the air from leaking out into the hallways.